Okay, so thank you everybody for joining another one of these brief team sessions. This Wednesday, I want to sort of introduce a new page that I've built on the research guide. That's the National Health Statistics and Data, and just kind of give a brief introduction of some of the things that can be found there. Like I was mentioning before we started, I know Dr. Lee might have looked at some already, but I wanted to point out at least the first three resources that I've put on this page that I think are pretty cool and could be used for everything from research to even just like maybe finding quick data answer that you need without doing a whole lot of digging. So if you start out at the Lucom Medical Library page and you scroll down to databases and expand it, click on Research Guide, and that opens up the Research Guide, what we call LibGuide, where we organize all of our electronic resources. And if you look across the tabs at the top, you'll see A to Z databases, course OMS 1 and 2, course guides, mobile apps. There's this new tab for National Health Statistics and Data. Excuse me. So if you click on that, you'll find there are a ton of resources available here, from everything from the Department of Health and Human Services, CDC, different governmental websites, healthcare websites, and you can find data on everything from diseases to demographics to health disparities and a lot of these different resources. And if you're not crazy about or not sure which one to start with, I wanted to point out this is something I'm not sure if I had this on before, but I added a link. There's a Google dataset search that you can use, and so this is actually, I mean, this is not like Wikipedia or something. This is real data that you can find using Google. So if you were to look for coronavirus COVID-19, you'll find data sets from different. Oh, really? Nothing? Okay. How about COVID-19? You'll find data sets from different. It's COVID-19healthdata.org. This is from the New York Times.
What about the VAERS? Is it on there?
What's that?
VAERS. Does it pull it up? I'm curious.
I don't see it, but I could be
do a search for it. No, VAERS. There you go. Oh, it does.
Cool. Vaccination. Yeah, sure enough.
Okay.
So that's just another trick that you can use Google for. And then the three resources that I really wanted to point out that looked immediately kind of useful to me. There's this AHRQ, is Agency for Healthcare Research and Quality, and this is made by the Department of Health and Human Services. And there's all kinds of stuff here, and they have things organized into something they call programs. So they have featured clinicians and providers. So if you're looking for evidence-based clinical answers, you could use that. But data and measures, education and training. If we click on, I just want to look at maybe clinicians and providers. You'll see you can search by topic. You can filter this out by education and training, quality and patient safety, even hospitals and health systems. So if I want to look up, whoops, not what I meant to do. I want clinicians and providers and hypertension. Well, that didn't match anything. COVID-19. Oops, sorry. I must not be using them. You can search for whatever your topic is, and you can find things for clinicians and providers. Maybe data and measures would give us a better. I was really wanting to find something on hypertension. No, I must not be building good searches, but you can search for different programs here, and they have featured education and training. You can find all kinds of things there. Under research, you can search publications, you can find fact sheets. Something I thought was kind of interesting about this is they have data on quality and disparities. So if we're talking about like underserved populations, this might be a useful resource to make note of. If you're looking for identifying populations that are underserved in healthcare, it's kind of cool. They have the reports going back years here available. Data. So you can find infographics, data available from AHRQ, healthcare costs. I'm not sure what some of these are, but I'm thinking these might be useful for different types of research projects. There's quality indicator tools for data analytics. I'm not sure what, whoops.
Yeah, some of those, Rob, like I think the AHRQ quality indicator tools and all, some of that is like data mining that I know some of the big EMRs now are putting together so they get paid better.
Well, I was mentioning before we started when it was just Dr. Lee here. I know in the past I've talked to Dr. Bauer about some resources he was kind of hoping we could get. And he was saying when he was at Pitt, they actually have EHR data, but it's like, I don't know how you say it, anonymized. Like there's no identifiable patient information, but there's the data from the EHR. So I'm hoping this can kind of be used in place of that because we don't have anything like that just yet. We may in the future, but so just kind of see what's there. They have tools. Something else I wanted to mention, funding and grants. This is kind of cool. I didn't know this would be useful for Dr. Gigliotti and his research endeavors, especially for next year when he's talking about doing those anchor weeks, and he was talking about doing anchor things about how to do research. But this might be useful because it's got literally like trainings on how to do grant applications, forms, the mechanisms and descriptions, how things work, how the award process works. I mean, we could use this maybe for kind of teaching students how the grant process and the review and award process works. So that's what's available. Some of the things that are available from AHRQ. If you go back to the National Health Statistics and Data, again, these are alphabetical. There's a ton of them. Something that looked cool to me was the CDC Wonder, and that pulls up this page built by the CDC. And there's all kinds of stuff here. They've organized it. They've got categories of AIDS, births, cancers, death, environment, population. But I mean, it's like you can see leading cause of death. I mean, it pulls up the data bank for that, fatal injury and violence data, leading cause of death and injury. New cost of injuries is just, I don't know how this could be used in different research projects, but it's pretty cool. They have so much stuff available here. Not just mortality. I mean, environmental issues, chronic conditions. Let's see here with something else, maybe cancer statistics. I know. So cancer incidence and mortality data. I can think of, I don't know, I'm sure you guys could think of like 100 different ways this stuff could be used, but this is just some of the things that are available there. And what else do I want to do? You can find topics here for chronic conditions and national notifiable conditions, and then you can go to A to Z index and you can find everything they have alphabetically. And you can tell who has that data here. And the last one I wanted to show, and so I'm thinking, when I was looking at these the other day, I was thinking the AHRQ and the CDC Wonder would be useful more for data sets for like research projects. But also there was this resource I saw called CDC Fast Stats, and it's down here under Fast Stats A to Z. And it's another resource built by the CDC. But this, I see this as kind of like if you're looking for data or like a starting point and you don't want to have to dig and find a bunch of like complex, data sets or anything, I can go right into here and just say access to healthcare and find quick references to reduced access to care, trends in access to healthcare from Healthcare United States. Just really quick kind of snapshot. So let's see therapeutic drug use, see what that is. Percent of persons using at least one prescription drug in the last 30 days, 48.6. I didn't have to dig through databases and data sets to find that. It's just got these quick snaps of information that may be useful. I'm thinking like as a starting point, or just want to get an answer without digging through a bunch of databases. But I can search all kinds of stuff here. I want to see. Well, actually, what was that? I wonder, what was that report called, Dr. Seiler? The VAERS, VA?
ERS. Yep. Vaccine Adverse Effects Registry site.
Okay. I might not have that exactly, but it's got National Immunization Survey. Well, yeah, you can kind of see.
There's other ways to get to it, I know, but
yeah.
Just so interesting cool. Data.
Yeah, and they've got this organized into diseases, infectious diseases, family life, healthcare and insurance, disability and injuries. So, you can see, I want to go back to here and see if we find, I was going to find diseases and injuries. Disability and functioning, that might be useful. So here, percent of adults aged 18 and over with any difficulty of hearing, 13.8. It's kind of cool to have such quick access to some of this data, like if you didn't really want to pore over a data set or something. So that's just kind of the basics of what I wanted to show. I know that's not like super deep, but those are just the three that really stood out to me. If you look at this, I mean, if you can consider what you can find with Google dataset search and then all of these repositories of data sets on different aspects, it's pretty powerful tools there. So that's pretty much it. If you guys want to talk more about this, please feel free to come by the library. I'll continue to try to look at some of these different repositories and see what's available and what. But those were just the first 3 that really jumped out at me as that could be immediately used. So,
no, I appreciate it, Rob. This is good stuff.
Thank you so much.
Absolutely. Thank you, guys. I hope you have a good rest of your day.
Yeah, appreciate you doing all these.
Yeah, sure.
Hey, thanks, Rob.
Sure, Dr. Delany.